In the last century, the human lifespan has increased more dramatically than it has in the last 4,000 years. In the 21st century, people will be leading longer, healthier lives than ever before. And even though aging is a natural process which often entails physical and mental deterioration, older people, like people of any age, can strive for maximum quality of life. Today's tape is going to focus on the physical changes with aging and what you, the caregiver, can do to help the elderly maintain the best possible health. When working with older people, the goal is to maintain and, if possible, increase the amount of participation in life in order to promote physical, mental, and emotional health. Each person has unique needs and abilities. This is as true of the elderly as it is of the young. However, despite our individuality, as we age, we can all expect changes to occur in the systems that make up the human body. Although exactly what kinds of changes will take place and when vary greatly from person to person, aging is inescapable. It's part of the continuum of life. We're going to be looking at the physical changes of each body system as we age. Starting with the central nervous system. Many people think that the elderly have reduced mental capability. Though this is true in some cases, most people can maintain mentally active and vital lives even into very old age. Though the number of brain cells start to diminish after about age 30, there are plenty of brain cells in order to maintain intellectual function for an entire lifetime. In a healthy person, the change in mental functioning is minimal. Sometimes, though, you can see slower completion of tasks and slower decision-making by the elderly that may make it look like the older individual is having difficulty understanding. But this is not necessarily the case. It may be that the individual just requires a little bit more time for processing information and for reacting to it. I'm sure you have experienced zipping down the expressway, as I have, and getting behind someone who's poking along at about 40 miles per hour. As frustrating as that might be, you need to remember that the elderly person that very possibly is the one in the car is moving at a pace that is safe for them to be able to continue to drive. Mild confusion may occur with the elderly, but it's usually not part of the normal aging process. It can be due to medications, depression, or any number of medical diagnoses. Recently, I visited my parents who live in an assisted living facility, and my father, although he's wheelchair-bound, is very mentally alert. On Sunday afternoon, he asked if I would help him go to the bathroom, and in the process of transferring him from the wheelchair to the toilet, he was having a great deal of difficulty, so much so that I needed to have someone come and assist me. This was not my father. In addition, he was having difficulty remembering activities that we had just done. He was not able to recall what had occurred the night before, and I knew this was not part of his normal mental state. So we ended up in the emergency room of the hospital, where he was diagnosed with an acute urinary tract infection and dehydration, examples of what can cause mild confusion. After receiving some fluids to hydrate him and getting on antibiotic therapy, his mental confusion has totally cleared, and he's very mentally alert at this time. So be sure that you report any confusion to the nurse, particularly if it's something new, because it might be a clue to something happening, a medical diagnosis that might be occurring or a new medication that might be causing it. Ways to help. Promote opportunities for intellectual stimulation. The saying, if you don't use it, you lose it, applies to brain activity as it does to muscles and other organs of the body. One is never too old to learn something new. That old adage that you can't teach an old dog new tricks really is not accurate. You can provide lots of opportunity for stimulation with things like challenging crossword puzzles, discussing current events, teaching them how to utilize email so that they can communicate with family and friends can all be ways to provide mental stimulation. Be patient with the elderly who are moving or speaking more slowly than you might like. Recognize that they're going at a pace that is safe for them and comfortable. By pushing them along may just increase their frustration and possible falls that can occur. The cardiovascular system includes the blood vessels and a heart. Natural changes in the cardiovascular system occur with aging and can have tremendous health consequences. The function of the heart, as you all know, is to pump blood through the body's blood vessels. In the older person, the heart may pump less efficiently. Blood vessels, or blood flow to the blood vessels, is reduced by about 1/3 by the time we are 60 years of age. Because of this reduced blood flow through the blood vessels, lots of times the elderly people have a sensation of cold. They feel cold much more quickly than we do. I'm sure you've noticed that elderly tend to be more bundled up than we are. Even on warm summer days, they'll be wearing long-sleeve shirts or sweaters to keep warm. So remember, layering is important, and provide them with the extra clothing because of the reduced flow of blood to the extremities. Because of reduced blood flow, blood vessels respond slower to changes in body position as well. Consequently, rapid changes in body position, such as standing quickly, can produce dizziness. Maybe you've experienced jumping out of bed quickly in the morning and seeing stars, possibly, feeling a little dizzy, feeling that you could almost fall over. It's happened to me. It's a result of the